Hello everyone, and welcome to my video entitled Introduction to a Non-Drug Recovery Program for Irritable Bowel Syndrome, Colitis, and Crohn's Disease with Functional Metabolic Protocols and Functional Neurology. So, what does that mean? First of all, I want to thank you for sitting down and taking the time to watch this video. You've either come across this video from the internet, from potentially Facebook, from YouTube, or a friend or family who's a patient of mine, or you are a patient of mine and you saw that I've made this video on irritable bowel and Crohn's and colitis, and I think you've done a right thing. I want you to get comfortable. I want you to grab a pen and paper because you're definitely going to be hearing things that you've never heard before. I can pretty much guarantee you that. And I think you'll find it very, very valuable. So let's go further into what I'm going to be talking about today. Basically, who am I? My name is Dr. Joel Rosen. I'm a board-certified chiropractic physician practicing here in in Boca Raton, Florida. I've been practicing for now 13 years. I'm a graduate of the Functional Medicine University. This is an online curriculum program. I'm not just the typical chiropractor. I have gone on for countless hours of extracurricular studies, one of those of which is called Functional Medicine University. Functional Medicine University is basically looking at a physiologic and biochemical approach to the metabolic breakdowns that occur in our body. You can find other practitioners that do this line of work called integrative medicine. And functional medicine is one of the leaders on educating doctors on the natural protocols for helping you recover. So that's an awesome program that I've finished. Also, I'm a graduate of the American Functional Neurology Institute. This is looking at the brain from a functional capacity in terms of what different areas of the brain may be fatiguing, may not be optimally functioning or firing, could have smell concerns, sensory perception concerns, eye movements, dizziness, balance, coordination, feeling things that you shouldn't be feeling or not feeling things that you should, having unsteadiness on your feet, numbness and tingling. So functional neurology is a great component of what we're going to be talking about to you today. I've also studied blood functional chemistry. Basically, how I got into this was I had a patient of mine who's an acupuncturist, and he brought this book in called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? Write this name of this book down. So it's called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And the doctor's name is Dr. Karazian. And what he does is he teaches doctors across the country on functional medicine and how to recover from any type of chronic condition naturally, because basically we have a series of different metabolic breakdowns that are occurring in the body. This acupuncturist brought this brought this book into my office, and it was like a light bulb went off. I realized from my own perspective that I had something called adrenal fatigue, and all the metabolic breakdowns that were occurring for this condition, like any other conditions like IBS, Crohn's, colitis, just different emphases on different areas where you may be breaking down. But either way, a light bulb went off, and I forever wanted to help patients that are coming into my office maybe 10% of the time with just neck problems and 90% of the time with neck problems, gastrointestinal problems. So if you're watching this video, you're going to get a lot of value out of this because you are someone that probably suffers with gastrointestinal inflammation, but that's not the only thing you suffer with, and we'll explain why and how and what as this video goes on. I've also studied under Michael Johnson. He's the author of this book called What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. He talks about IBS and Crohn's in this book. I urge you to get this book, but you don't necessarily have to, because what I've done is I've gone ahead and created this video for you so that you can sit down and just kind of relax and get all the information that I'm going to present to you. Will include some of that stuff. Also, I have an undergraduate degree in exercise physiology and also psychology. So I'm not just the typical chiropractor that practices on patients that have bad backs and bad necks, but basically bad bodies, bad brains, bad guts, bad metabolic processes, and that's creating a whole clinical picture of why you're suffering. So that's what I wanted to get into today is what do a lot of people that have chronic conditions that come into my office have in common. So I have patients that come in with celiac disease, insulin resistance, thyroid conditions, like your case, IBS and Crohn's and colitis, but also peripheral neuropathy, chronic neck and back pain, insomnia, not being able to sleep, blood sugar problems, sciatica. So basically, what do all of these things have in common? And the things that they have in common are metabolic imbalances. Basically, potentially there's an anemia or there's an oxygen problem that's not being delivered to all our cells. And as you'll see in this video as we go forward, your brain, your neurology needs two things to function optimally. It needs fuel in the way of glucose and oxygen, and it also needs stimulation from all the cells. And anemia, if we're not carrying oxygen efficiently, then potentially we are not delivering the fuel in terms of oxygen to the brain, and then all of a sudden we start manifesting different metabolic problems. Thyroid dysfunction, unstable blood sugars, too high or too low, we'll get into that. Adrenal gland dysfunctions, we're under a lot of stress. We have the standard American diet that's filled with a lot of processed foods, fast foods, sugary foods, and devoid of nutrients, and that will lead to a lot of dysfunction in our body. Hormonal imbalances. I'm sure you or a loved one watching this have a hormonal problem. Your libido potentially is gone, your strength and energy is gone, and you're coming in with, you're telling your doctor that you have a gastrointestinal problem. They're giving you some kind of medication to address that, but it's not affecting any of the hormone problems. Autoimmune, you'll find that autoimmune is a huge problem. 80% of our immune system is in our gut. So if you have a gut problem, then 80% of your immune system that's housed in there is potentially not going to be optimally working as well. And the next thing you know, you start having overactive immune system, and it starts attacking your thyroid, it starts attacking your colon, it starts attacking your GI tract or your joints. And these are autoimmune conditions like Chrons, colitis that we're talking about, but also celiac disease, also rheumatoid arthritis, even Alzheimer's, Parkinson's, and that all originates from the gut. Hidden infections is a huge problem. Bacterial infections, viral infections, parasitic infections, fungal infections, yeast infections, huge problem. Hypoxia kind of goes along with anemias, chronic inflammation. Other things that I don't have in here that could be is environmental triggers like plastics that we come in contact with, or electromagnetic radiation, or heavy metal toxicity. A lot of these are creating problems in our body as well, and you wonder why you're still suffering. Then there's also, of course, the neurological imbalances. So that's what I've done, is I've married the metabolic program that I've studied under Functional Medicine University, as well as the neurologic components, and I've sort of married those two together. So what I tell patients is, if you had to leave right now and you couldn't watch the rest of the video, then I want to get you to write this triangle down. The first part of the triangle at the top I want you to write out, my body has the ability to heal itself of any condition. So write that out. My body has the ability to heal itself of any condition. And that, if you Google that, studies show nowadays that your body has everything it needs to correct itself with any health problems. However, a lot of the times it doesn't have everything it needs. There's too many other things going on. The other part of the triangle is going to be metabolic. And that's going to show your immune system. You say 85% or 80% of your immune system is in your gut. And if you have a healthy immune system, then your body is potentially going to have the environment to heal itself. And on the immune system, we have the gut. We have all these things here. And then lastly, on the last base of the corner, we have neurologic. And neurologic is basically our brain, pardon me, our brain and our spinal cord. And our brain and our spinal cord basically controls every cell, tissue, organ function of the body. And if the nervous system doesn't get the proper fuel and activation from the other corner, from the immune system, then potentially our body does not have its ability to heal itself. So that's what this video is going to talk about today, is our ability of our body to heal itself, the immune system and fixing the immune system, and the nervous system and fixing that, and how all three interrelate with each other. So let's talk about metabolism. A lot of people hear the word metabolism like she's got a slow metabolism or he's got a fast metabolism. But basically, what is metabolism? Metabolism is basically you eat food, and with proper digestion, that food becomes bioavailable and it converts that into energy. So if we're watching this video and you suffer with a gastrointestinal problem, then potentially, or not even potentially, then you have a problem with your metabolism, because you're not assimilating, you're not digesting, you're not absorbing, and then that food doesn't become bioavailable, and then your energy systems go down. And when that happens, because our brain needs fuel and activation, then all of a sudden the fuel that you're taking because of your metabolic breakdowns is not giving the adequate amount of energy to your brain, and that's creating a lot of deficits as well. So that's the way we explain that. One of the questions I always like to ask my audience or my patients, or if I do a seminar, is 30% of our energy goes to what system? So we eat food, it gets converted ideally into energy, and then we have different systems in the body that requires that energy. We have the endocrine system, so that's producing hormones. The digestive system, that's obviously breaking down the foods. The nervous system, that's our brain and our spinal cord. The immune system, that's the ability to fight infection. Or the cardiovascular, that's the heart and lungs and pumping oxygen. Which one of these things do you think requires the most amount of energy? Well, the answer is the nervous system. So the nervous system composes of our brain, our spinal cord, and our nerves. So if you're watching this video, some of you are really suffering. And if you're really suffering with gastrointestinal inflammation, and 30% of the energy requirement from metabolism goes to our nervous system and our brain and our spinal cord, and if that's not functioning optimally, then guess what? Then potentially your brain and your nervous system is not functioning optimally. And we need a proper functioning gut for good metabolism, for a well-functioning brain. So that's the gut-brain connection. So I'm sure you've heard of that before. We get butterflies in our stomach. We sort of go with our gut instinct. Our gut is our second brain, and whatever travels through our gut into our bloodstream goes to our brain and into our brain barrier. So there's an intricate connection between the two. So let's talk about that, the gut-brain connection. The father of medicine, Hippocrates, said, "Look to the gut, and there you will find the origin of all human illness." It's amazing that that was said, centuries ago. I did a little research on him on the internet, and he lived in his day, like I think it was 370 BC. He lived to the age of 90 years of age at that time. And I think in 2010, the average American lifespan was 78 years old. So back then, he outlived the average American in 2010 by 12 years. And yet we are more advanced with our medical system, supposedly. We have more information about biochemistry, about physiology, about microbiology, about disease and illness. Yet what has happened? We have dominated our healthcare system with medication, and we forget that healthy living and our gut is where the immune system takes place. And if that's functioning optimally, then we're feeling healthy, and we're playing with our grandchildren, and we're traveling, and we're not fatigued, and we're not keeling over from bouts of pain in our stomach, and we're not sitting on the toilet all day. We have a healthy gut, and that's the irony is that the more things change, the more they really stay the same. And once we have a tenet of good health in our gut, that doesn't change. However, with our advancing healthcare system, it becomes a battle of taking this drug and that drug, and then you're wiping up, all the natural flora in our gut, and that's creating a huge problem. So I thought that was interesting. This is a great slide. I want to explain it to you in detail. Basically, if we have gut inflammation, so if we eat a food that our system doesn't necessarily like, or there's irritation in our gut, then usually what that's causing is an immune reaction. And that immune reaction creates these things called pro-inflammatory cytokines. Those are basically chemical messengers to tell the different cells to start fighting off infections. Ultimately, when we have too much inflammation in our body, it creates something called leaky gut. I want you to write that down, because I pretty much guarantee that you have a leaky gut. Leaky gut basically is, think about your gut like a fine metal strainer. Like if you're making pasta and you're boiling pasta and it's hot and it's ready to go, and then all of a sudden you got to put it through the strainer and then get all the water out and then use that pasta to eat. basically that's how our gut should be. Our gut should be nicely arranged with lining and tight junctions, and basically the water will filter right through. However, when you have leakiness in your gut, then it sounds exactly like it says. You have these big holes in your gut lining, and so now you're not filtering the water with a fine metal strainer, you're filtering it with a colander. So when you pour the pasta into the colander, not only is the water filtering through, but also the food is filtering through, and that's passing through there. Basically what that will do is that will create food sensitivities. Now all of a sudden your immune system starts attacking that, and then every time you eat that, that's going to create even more sensitivities. What also happens is whatever travels in the bloodstream now goes to all the different cells. So now you have an immune reaction. Food particles have passed into the bloodstream undigested. Your immune system starts to create complexes or antibodies to fight that. And now all of a sudden that immune system with antibodies and white blood cells circulating through your brain or your body now goes to the brain. And then they cross the blood-brain barrier. And that creates something called release of microglial cells. Just like we had pro-inflammatory cytokines in our gastrointestinal lining, now we have these defense cells called microglial cells, easy for me to say, that cross the blood-brain barrier, and that creates inflammation in your brain. And if you have fire in the gut, like I'm sure you do, then you have fire in the brain. Fire in the brain could manifest as depression, as headaches, as its sensitivities to smells and lights. We can also have, you can have a bunch of stuff with that. You can also have forgetting where you put your keys, or driving your car and parking in the parking lot and not knowing where that is, or trying to find your wallet. So if any of these things sound similar to you, it's not a funny thing. It's a sign of neurodegeneration because of inflammation that, like Hippocrates said, all originated in your gut. And none of your doctors are telling you this. So 70% to 80%, I've even seen it as high as 85%, of your immune system is in your gut. Anything that causes an immune battle in your gut will create inflammation. So that's what that last slide showed. So food sensitivities can cause a battle in your gut. Chronic infection can cause a battle in your gut. Bacteria, parasites. So now think about that fine metal strainer. So we have this fine metal strainer that becomes a colander, and now these food sources start passing into our gut, into our immune system, into our bloodstream, and that's what we're creating inflammation. But not only is it food particles, now we have bacteria, we have viruses, we have parasites, we have molds or yeasts or fungus. All this stuff is getting into our body now. It's passing through those open colander holes now as well, and that's creating immune dysregulation. So like I mentioned earlier, we have these cytokines in our body, and then that's from the gut, and then when we have inflammation, those cytokines get traveled to the brain, cross the blood-brain barrier, and tell the microglial cells, sort of the defense mechanisms in our brain, to fight off inflammation or fight off infection by creating inflammation. So 90% of our brain cells, did you know that 90% of the brain cells are immune cells? They are called microglial cells. So like we just mentioned before, once those microglial cells are triggered, then you have inflammation in your brain. Activating microglial cells causes brain inflammation. Poor Homer, he had a little bit of a brain problem there as well. So the big picture, IBS versus Crohn's. Let's talk a little bit about that. So hopefully your light bulbs are going off in your head, and things are starting to make a little more sense with you, and you're understanding why the medication that you've been taking hasn't been helping your gut per se, because it's not affecting the inflammation, it's not removing food sensitivities, it's not addressing any infections that you have, it's not talking about any autoimmunities, it's not talking about blood sugar dysregulation. Any of that medication isn't doing that. And we try to take one pill for this, and then what happens? You take another pill because all of a sudden you took a pill for something and you started getting headaches. And then you tell the doctor, you know what, I'm starting to get headaches, and then he gives you a pill for something else, and that creates a restless leg. And then that you would take, so next thing you know, you're taking 4, 5, 9, 10 different pills. But let's get back into IBS and Crohn's. Both cause similar gut dysfunctions, both cause similar symptoms throughout the body, but the causes of each of them are very different. IBS common symptoms are abdominal pain, I'm sure you're aware of, fullness, gas, bloating, acid reflux. IBS-C is the obviously when we're constipated, or IBS-D is when we have diarrhea, and it can fluctuate between both of those. Those symptoms come and go. They're typically relieved after a bowel movement. 1/6 of the people have this. It is the most common cause of the visits to the gastroenterologist. So you probably have this. Also, it's a diagnosis of exclusion. So if they can't find anything else going on, it's like, well, you must have this then. Other symptoms of IBS, 60% of IBS sufferers have psychosocial disorders like depression and anxiety. Does that make sense? Why? We have fire in the stomach, that gets fire in the brain, and that triggers a whole host of brain inflammation chemicals, problems with depression, anxiety, irritability, and we wonder why. So other problems could be fibromyalgia, chronic fatigue. And why is this? Because of that gut-brain connection. So IBS common medical treatments, we have all these different drugs that I'm not even going to try to pronounce properly, but dicyclomine, propofol, hyoscyamin, I can't pronounce it. But basically they're designed to slow down the sympathetic behavior of your body. Loperamide for diarrhea, tricyclic antidepressants. Now something must be wrong with you because we can't fix your problem and you're getting depressed, so let's fix the depression. Doesn't it make sense to actually fix the cause of the problem? And that's what we do in our office. So these are treating the symptoms and not the cause, and that makes sense. You want to get back and fix the problem, not just sort of the result of the problem. Causes of IBS are linked to gut infection, bacterial, fungal, yeast, parasite, viral, abnormalities between the gut flora or the gut immune system, overactive sympathetic nervous system, the brain is imbalanced. So when that brain gets too much inflammation, all of a sudden it's going to kick out some sympathetic messages for processes to speed up. And then that creates a whole host of problems. Your brain is basically overfiring. And how can this happen? Well, let's talk about the blood-brain barrier connection. Your brain is basically one big sensory organ. So it takes in information from the environment and processes that information and then creates a motor response of what to do with that information. It's like data input. You have faulty data input in, you're going to get faulty data input out. And that's what's basically happening here. Your body is one big receptor, so information from our eyes, our ears, our sound, our taste, our touch, gravity, all of these things create pressure on our joints, create sensory transmission to our brain, and the brain processes that. And we have receptors everywhere in our muscles, in our joints, in our skin, in our eyes, in our ears. But as another question, which one are the two main receptors that stimulate our brain over and over again? The answer would be touch and gravity. So the fact that gravity, we're alive and gravity is pulling us downwards, it's always stimulating our brain to take in that sensory information to keep it alive, basically. So let's talk about the three parts of the brain. We have the cerebellum, that's called the little brain. That's responsible for eye movement, for balance, coordination. We also have the cerebrum, which is the big brain. We have parietal lobes, we have frontal lobes, we have temporal lobes. That's possible for higher reasoning. And then we have the brain stem. That's where we house a lot of our cranial nerves. So sight, sound, taste, muscle contractions, all of these things are in our brain stem. How the brain works, basically it gets sensory input from the body and it's sent to the opposite side of the lobe. So neurology 101, the right side of the brain is responsible for the left side of the body sensation, and the left side of the brain is responsible for the right side of the brain. The upper brain has a major connection to our brain stem. The brain stem basically puts the brakes on the system. So if our brain stem is not optimally firing without braking, then we have an overactive sympathetic system in our body. And that just sort of shows that connection. An overfiring sympathetic nervous system can cause, what does it cause? Chronic pain, chronic fatigue, IBS, Crohn's, urinary tract infection, fibromyalgia, migraine, tension, headaches, posture, bad posture, so we call it Bigfoot, where we're looking down at our feet, and even adrenal gland stimulation. And we focus on all of these things when you come into our office to recover from your GI problem. Overfiring sympathetic can cause blurred vision, increased sweating, dizziness, heart palpitations. So it's not just the gut that you're coming in with, but you're coming in with potentially any of these problems. When the cerebellum fatigues, you have loss of balance, vertigo, chronic pain, clumsiness, disorganized thinking, and that would be this area here. And that shows that diagram again. We have also frontal parietal lobe. So depending on what part of your body is not getting the optimal activation and fuel necessary for vital processes because we're not absorbing these foods, then we could have a frontal lobe problem, a parietal lobe problem, a temporal lobe problem. And it's not necessarily you have brain damage per se, but they're not firing at the same rate of frequency that they need to fire. And then that's creating a lot of other problems as well. It could cause depression and anxiety, difficulty reading or scanning pages, adding, subtracting, understanding language, memory. How many of us, again, have that memory problems where we forgot what we were supposed to be? Where are my keys? You know? And when we're having these things, then we're having signs of what we call neurodegenerative changes. Lack of focus, also altered sensation, numbness, tingling in your hands and your feet. Anger, irritability. Does your wife or does your spouse or your husband, have they changed over the years? I'm sure they have, and a lot of this is caused of brain degenerative changes. Lack of motivation. How does this all happen? So this is basically chemical stress, physical stress, emotional stress. All these cause the brain to fatigue, and then they don't have the same amount of impulses. So instead of firing like this, it starts firing like this. Causes problems. Chemical stress to the body. Again, we talked about too little blood oxygen, high or low blood sugar levels, sensitivities to foods. That, never really talked about that yet, but you know, when we start eating foods that create leakiness in our gut, then all of a sudden we eat a gluten, which is a grain, the peptide structure, the protein structure in that, or we eat milk, or we eat eggs, or we eat cheese, and every time we do that, it fires off the immune system. Then we create fire in the belly. The immune system travels to the brain, the bloodstream travels into the brain, releasing microglial cells, creating now a problem with the brain function. We just talked about that earlier. Poor diet, also not having a good ratio of omega-6 to omega-3. A lot of the times we have too high omega-3s. Hypothyroid problems, prescriptive drugs, that's getting rid of the normal flora in your stomach, and now we have an overabundance of bad bacteria to good bacteria, and that will create inflammation and infections as well. Emotional stress to the brain, being stressed out all the time, adrenal gland disorders. That's when our stress hormones are kicking off too much from inflammation, from infection, from an injury, from our IBS and Chrons problems, and that's creating high insulin and glucose levels, cause your brains to break down as well. Metabolic disorders that cause brain imbalances, we talked about this again, anemia, blood sugar imbalances, food sensitivities, adrenal gland dysfunctions, thyroid dysfunctions. So how do you know if you have that? Has your doctor told you if you suffer with any of these? I mean, how do you really know? You got to do the proper testing. And I'll tell you what, in today's healthcare system, proper testing is like a four-letter word. They only test for things that are necessary based on your blood results, and then you're never doing the accurate amount of testing. Have you been tested for your adrenal glands? Have you been tested for food sensitivities? Have you been tested beyond just TSH for thyroid antibodies or any autoimmunities? I'm probably guessing you haven't. And the other thing is, if you have been tested for these things, you've probably been told that your blood tests are normal. And that's what this book talked about is why do I still have symptoms? So just cross that out and say, why do I still have gastrointestinal symptoms when my blood tests are normal? And this will explain this to you. Basically, we have what's called a functional range and a laboratory range. The laboratory ranges are what's called pathological ranges, which mean if you're too high on the high end or too low on the low end from a pathological point of view, you're considered sick and you need to take medication. If you're not, then you're considered normal. And that doesn't necessarily mean you're normal, it just means you're not sick enough at this point to have to go on medication, at least for that lab value. And so what I tell patients is the functional ranges are what's getting an A in your health, and what's getting a proper vitality and energy and vigor, whereas the pathological ranges are now we got to do medication. So you're probably not being evaluated for your functional ranges, and when you come in and we look at your blood work, we'll do that for you and explain a whole new realm of different things you never knew you had. Like, for example, glucose. A lot of the times I'll see people that are hypoglycemic. They may come in with a 73 resting blood sugar level, and they're told that they're normal because normal from a traditional range is 65 to 110. However, it's below the functional range. Or let's look at TSH. TSH, you may be told it's normal, and yours is 4.2. And it would look like normal because 0.3 to 5.7 is a traditional pathologic range. However, above 1.8 to 3.0, you're already high. So that's why your lab tests are normal when you still feel crappy, is because you're not testing from an optimal functioning healthy point of view, where symptoms don't wait for it to be in a pathological range before they start to say, hello, I'm bothering you. They start when they're starting to get out of the range before they're too far gone, and you can affect that naturally. And that's what we got to with Hippocrates, is looking to the gut and changing your lifestyle. I mean, instead of going on a pre-diabetic medication, how about changing your lifestyle? Or before going on a high cholesterol medication, how about we change our lifestyle? And so, I hate to be sort of the messenger, but if you're thinking that this program is going to be able to get you better just on taking a medication, then this video is not for you. This is about making serious changes in your life. And no one's going to care about your health as much as you are. So if you are suffering, it's time to look in the mirror and say, I got to make a change here. I got to start taking responsibility for my health, and I want to do the things that I love to do. And I don't want to have a shitty, pardon my language, I don't want to have a crappy life. I want to get my life back. Sorry, I shouldn't have sworn. Based on your history, we may run a lot of different tests. We may want to look at the complete blood chemistry. A lot of you have done that, but I'll be surprised how many people have not done that. And if you don't have insurance, don't worry. We put together a great plan for you to be able to afford either pay all at once or have a low monthly payment, where when I tell a patient what my monthly fee is and they say they don't want to do it, then I know they're not wanting to get better because they're just not taking responsibility. They're going out and buying a big screen TV, or they're going out for dinner 4 or 5 nights a week, but yet when I tell them to make an investment on their health and they're not willing to do it, then it's a waste of my time. And I'm not looking to waste my time. I'm looking to change your life. We do salivary hormone testing. That's going to test for the hormones in the adrenal glands, stool ecology. We will also do food sensitivity tests. These are the best tests in the world. And I'll tell you what, insurance doesn't pay for these tests. And you may be saying, oh man, insurance doesn't pay for it, and then I can't do them. And stop being a victim. Just because insurance doesn't pay for it doesn't mean that you shouldn't do it. In fact, if insurance doesn't pay for it, more than likely means you should do it. Like I said, you have wide lab ranges, and so unless your test is way over here or way over here, insurance is going to tell you you don't need it, that you're healthy, that we don't want to spend money on you. And you've kind of gotten brainwashed and say, yeah, I don't want to spend money on me either. And so these tests will be life-changing for you if you do, and will get your life back. Functional medicine and metabolic treatments. We do a nutritional protocol for you. We do a 6-week detox. We eliminate certain foods that you're reacting to. We clean up the gut. We also clean up the blood sugar levels. We affect the adrenals. We also try to limit the immune reaction in your body. These are all protocols that I do every day in my office. If there's a brain imbalance, then we also need to do what's called brain-based therapy, and that's where the functional medicine meets the functional neurology. So if I have a deficit in my parietal lobe and I'm not sensing things as good on my left side as I am on my right side, then I can do a neurological treatment to wake up the nerves in my body. That's called the rebuilder treatment. Write that down, rebuilder. And we call it peripheral neuropathy rehab therapy. We do that in our office to stimulate the brain. We also do sensitivity, light eye movements or smells or coordination, and things that are all designed to get the brain firing optimally so that now we are not just functioning with a bad gut, but we also are affecting our cognitive ability. So like I said, we need fuel and activation, proper oxygen, proper glucose, and we also need proper brain activity for us to get better. We also do what's called unilateral manipulation, oxygen with therapy. We don't do that in our office, but other doctors do. Vibration therapy, warm water, calorics, stimulating cranial nerve 8. We do spin therapies that will help the cerebellum. Physical therapy, visual therapy, olfactory therapy, eye exercises. These are therapies that are used to stimulate the different areas in your brain. Crohn's disease, let's talk about that. It's an inflammatory bowel disease. The other is ulcerative colitis, causes ulcers, scar tissue, fistulas, mouth to anus, high incidence among smokers. It's an autoimmune disease, so we got to fix your gut and reduce your inflammation. It goes through periods of exacerbations and remissions. It's similar to IBS, but we also have some inflammation in the eye or inflammation in your joints. Also skin nodules, ulcers, blood clots, anemias, peripheral neuropathies. These are the people that are really suffering that I can help you with in my office as well. It's an autoimmune disease, so it doesn't mean that we just address the gut. We have to address the immune system. Other autoimmune conditions are Graves, rheumatoid, diabetes, anemia, and 1/5 of the people that I see are autoimmune. And what do? They go on steroids. Or they do surgery, and it hasn't affected any of the immune system. We need to remove the triggers that are affecting the immune system. We need to do that, and we need to correct the damage that's going on in your gastrointestinal tract. We also need to address food intolerances, regulate your blood sugar levels, get your diet optimally functioning, and do hormone testing as well. So again, we do proper blood work, a great workup, complete blood work, adrenal stress testing, potentially a stool evaluation, and then a test for leaky gut and also the food sensitivity testing. Our diet program can include vitamin D, nitric oxide, glutathione, phosphatidylserine, omega-3s, and other nutritional compounds. So depending on what you're presenting with will depend on some of the nutritional compounds that we're going to recommend. And don't worry if you're concerned that it's going to interact with your medication, because these are all nutritional compounds that you can use to help regenerate and repair your metabolic breakdowns. We also have something called RepairVite that we use from Apex. These are proven substances that repair the lining of your gut. Digestive enzymes and probiotics. You're going to have to do some work here to get your gut better. Neurological consequences of Crohn's creates weaknesses in the brain. We talked about that earlier. So hopefully by now you realize what makes our office different. This is probably different than any other doctor or information you ever heard before. That's because we work with our patients neurologically and metabolically. So I'm here to tell you that when you come in, I'm not going to leave any stone unturned for you to get better and to exhaust all the reasons of why you're suffering. So what's next? The next thing to do is really to take some action. I can give you all this information, but you could not do anything about it. So basically what I'm going to do is we're talking about coming in and doing 2 visits in our office. In our office on visit 1, we're going to do a complete neurological eval. This is better than any neurological exam that you've ever done. I can guarantee you that. We're going to be looking at your large diameter afferents, your 2-point discrimination, your light touch, your vibration, your joint position sense, your ability to sense compared from left side to right side. We're going to be measuring your eye movements, your balance, your coordination, your blind spots, your muscle strength. And I guarantee when you finish that, we'll know where the deficits are in your brain that's not firing optimally. We also get you to fill out our neuro assessment form and our metabolic assessment form, and we marry those 2 together. I always request that you bring a spouse, because there's nothing worse for me to explain to you what's going on and what you need to do, and then you say, okay, I got to explain it to my spouse. That's a waste of my time, and it's a waste of your time. In case 2, in the second visit, I'm going to go over what we basically discovered on Discovery Day and let you know if I think I can help you. If I don't think I can help you, I'll let you know. I'll let you know if I can accept the case. I'll do also an overview of what testing you need to be done. I'll go over all the examination findings and what we're going to do to get you better. And again, your spouse needs to be present for that. My offer for you is I only accept 5 new IBS and Crohn's patients per month. I work with fibromyalgia patients. I work with peripheral neuropathy patients. So I limit it to a certain number of patients per month. Typically, this would cost $450 for the complete neuro exam that I do and my report of findings. However, if you call me and tell me you want to set up an appointment based on watching this video, then I'm going to charge you only $99. That's a great deal. The other thing is that if you call me and you pre-set your appointment, so you say, hey, not only do I want to come in, but I'm going to pay you to hold a spot for me, then it's only going to be $49. So I think that's a pretty good deal. The 3 rules that I have before I accept you is you must be willing to make some serious changes. I talked to you earlier about that. It's not going to be easy. You're going to have to make some serious changes if you want to get better. You have to take accountability for your health. You know, a lot of this program is not going to be covered by your insurance. I'll tell you that right from the get-go. There may be some reimbursable things that I do for my therapies in my office, but for the most part, you're coming out of pocket. And I tell my patients, when you take accountability for your health, then that means you're no longer a victim of what your insurance tells you you can and can't do. I always tell patients, how is it that you have a car, Mrs. Jones, but your insurance didn't pay for your car? You thought your car was valuable. Or how is it that you have an education from a school, from investing in yourself that way, but your insurance didn't pay for? Or more importantly, how do you have a house and your house wasn't paid for by your insurance? Yet, when it comes time to take care of your body for a chronic condition that no one else has been able to help you with because they've never looked at the things that we're looking at for you, then why do you say, no, I can't do it because my insurance doesn't pay for it? So that's the bottom line. Insurance, however, only pays a small portion, Medicare insurance, of this care. We've made this very affordable for our patients, so 96% of them can do our program. And basically, if you can afford $150 to $300 per month on a payment program, then you can afford my care. So if you tell me you can't afford $150 to $300 per month, and you want to know if your insurance is going to pay for this if you come on in, don't waste your time, because it's not. And if you can't afford that, then we can't help you. And I'm sorry that that's the way it works. Unfortunately, insurance is a broken model. I wish insurance paid for our care, but it doesn't. And you know, until you decide to take action yourself and responsibility for your health, you're going to be a victim. On a scale of 1 to 10, I want you to think about how serious this problem is. How long have you had it? How long have you been suffering? What are the things that you're not being able to do? Maybe you only see yourself as a 2. Then this is not for you. This is for someone who sees this as an 8 or higher. How long has this been affecting you? How has it been affecting your relationships with your loved ones? How much are you enjoying your life? On a scale of 1 to 10, how serious are you of eliminating this problem? We want you to be serious before you give my office a call. So like I said, due to this time constraints and wasting my time in the past with patients that I give this information for, that's why I created this video. So I don't have to explain this over and over and over again. It's necessary that if you want to come into my office and you haven't watched this video, then I'm going to tell you to watch this video and sign an affidavit saying that you watch this video so that you know exactly what I'm doing in my office. I want to thank you for watching this video. Hopefully you found it informative. Hopefully you're motivated to do something about your health. Hopefully you want to take advantage of my offer for $49 to come on in. And I don't really think you have anything to lose with that. In fact, I spend a lot of time with patients for that $49 to tell you if I can help you. What you'll want to do is you'll want to actually give our office a call. I don't think I wrote it down on this video, but basically our office number is 561-883-0090. Again, it's 561-883-0090. Call David, let him know that you want to come in and take advantage of our first 2-day special for the IBS, Crohn's, and colitis video that you've watched. And when you come on in, I need you to wear a pair of t-shirt and shorts so that we can do a complete neuro exam. And I want you to call and get my metabolic assessment form and my neurologic assessment form filled out before you come in here, and so that we can give you an optimal idea as what we can do to help. So once again, thank you so much for watching my video, and I look forward to seeing you in my office. Thanks.